Hello, everybody. My name is Dr. Sandip Raha. I'm a movement disorder specialist and worked in UK NHS for nearly 25 years as a Parkinson specialist. I like to talk to you about basic questions on Parkinson disease and how to suspect Parkinson disease in friends and families, and what are the options in terms of treatment, and answer some of your questions, which I have come across from various webinars in UK and in India. Risk of developing Parkinson's or Parkinsonism. Age is the biggest risk factor. It is more common as we get older. In over 60 population is 1.5 times commoner than normal population, and in over 85 it's 3 times more common. Long-term loss of sense of smell in terms of olfaction without any obvious local nasal cause is a serious risk factor of Parkinson or Parkinson disease, and is 3 times more common than general population. Similarly, long-term constipation is also a risk factor. By that I mean opening your bowels less than 3 times a week, and this increases your risk at least twice the normal population. But the research on this particular topic on constipation has been mainly in Western world. Sleep disorder is one of the major risk factors to develop Parkinson's disease, particularly long-term sleep disorder. I had many patients who had this sleep disorder for 10 or 15 years before their diagnosis. By sleep disorder, I mean thrashing in bed, regular vivid dreams, sometimes falling out of bed for no reason, screaming, and even grabbing hold of bed partners. Now, these are described by bed partners as the person affected won't be able to tell, and they will say, I have no problem in my sleep. Sleep disorder makes it 3 to 5 times risk of developing Parkinson's disease. History of repeated head injuries like rugby players, footballers, boxers increases the risk. Long history of anxiety or depression makes it more common to have Parkinson's disease. Those who have got young onset Parkinson's disease, less than 40 years age at this diagnosis, most likely they will have a strong family history of first-degree relative developing young onset Parkinson's disease, and likely cause there will be one of the genetic mutations. When to suspect Parkinson's disease in your friend, family member? Unilateral resting tremor. It's very important to classify it as resting tremor. It could be in the upper or lower limb. Typically, it improves on action, so mainly at rest. By that I mean, if you're carrying a cup of tea or holding a plate or using knife and fork or a spoon or writing, the tremor or shakes gets better in Parkinson's disease. Clumsiness and slowness of hands, particularly if it is unilateral. Like while brushing your teeth or doing your shoelaces or drying yourself with a towel after shower. The next slide, reduced arm swing on one side. Now, Parkinson's disease always starts on one side, and it is noticeable by family or friend that the shakes may be while person is walking. He or she may be slowing down or falling behind when walking outdoors, particularly with the friends and families. Turning or getting in and out of bed can be difficult. and particularly if this is progressive for many years. Stuttering walk, stuttering gait, difficulty in turning in outdoor situation is also a clue. Some atypical features of presentation of Parkinson's disease: if there is no tremor and the whole body is rigid and stiff, leaning forward, falling forwards, these are called axial Parkinsonism and in fact got worse outcome. These type of patients are unable to stop in a downhill path. They have difficulty in getting going after sitting for a while in a chair. They stutter and have hesitancy in starting to walk. There is a change of personality, becoming more quieter and less interested in life or social situations. And there may be a long history of anxiety as well. When to seek help? Combination of any of these symptoms, particularly in older person, male or female, over 60 age group, should ring alarm bells. But more so if there is a change of gait, balance, or walking speed. Parkinson's disease is more common in male than female, nearly 1.5 times more in male than female. See your local doctor first. If family have picture of the person's face or handwriting going back many years and comparing it with the current face and handwriting, that could be useful. Video clips of walking or shakes are useful for doctor, and these days video clips are easily catchable by smartphones. Although it is classed as brain or neurological disorder, but a lot of symptoms of Parkinson's disease are outside the brain. Like I mentioned about bowel, mentioned about sleep, REM sleep behavior disorder, mood, gait, similarly change of personality and speech. Speech becomes monotonous. There is no variation in the volume of speech. But these changes can be subtle over many, many years. Lack of dopamine is the main cause of Parkinson's disease. We all got this neurotransmitter in our brain, particularly rich in basal ganglia, which is a part of motor center of brain. And due to the lack of dopamine, there is a lack of spontaneity and slowness. This results in lack of alertness, reaction time gets slower, tremor and constipation, rigidity in limbs, and change of voice, as I mentioned. Treatment principles. Basic initial treatment is replacement of dopamine in form of medicine. And this replacement can be done by many different ways. Treatment is lifelong. We cannot cure this condition at present. It is a progressive neurological disorder. And no treatment can halt the progression either, unfortunately. Specialist clinic in hospital or private clinics, as well as Parkinson nurse in UK and Europe, provide the best care. It is very important to see a Parkinson specialist and stay under one doctor's care on a regular basis. Positive points in managing Parkinson, as I mentioned, is a lifelong journey. Exercise of any form, particularly resistance exercise, improve dopamine delivery, as well as targeted physiotherapy. And this has been proven on many Western research. Keeping active and positive helps. Normal lifestyle and routine should be encouraged. There is no restriction, holiday or flying, even driving in first few years of diagnosis of Parkinson, as long as driver license authorities are aware and your car insurance company is aware. Taking up hobbies like walking, gym, yoga, dancing, or even Tai Chi. Tai Chi has been shown to improve the balance and coordination as well as reaction. Every patient needs regular follow-up in a specialist clinic under one specialist consultant. Any question, more than happy to answer it through web or WhatsApp or in social media. Thank you.